Welcome to True Health Tuesdays. Okay, today, arthritis, cause, cure, and reversal. Now, this is going to hurt some people's minds because you're going to think that it's supposed to be a degenerative disc disease, but we're also going to go over how a lot of it's misnamed. Okay, now, we're going to go over the two main types of arthritis. One of them is osteoarthritis. This is the most common cause. Now, ignorant physicians will, because osteoarthritis has, it's also called degenerative disc disease, degenerative joint disease. Ignorant physicians will say it's from the body just wearing out. Well, that's foolish, and you'll see that that is foolish. Typically, it's not symmetrical. It can be here or there. It's generally the result of trauma. Rheumatoid arthritis is when the body attacks itself. Now, I wasn't going to bring up rheumatoid arthritis at all because we've done a whole talk on it, but I'm getting so many people with the rheumatoid arthritis diagnosis. And now, rheumatoid arthritis, you're supposed to have a positive RA factor on the blood test, which is a snapshot in time, which is not definitive. It's supposed to be symmetrical, okay? Which means if you got it on one finger, you got it on the other finger. And a lot of times I'm getting these people with this diagnosis with a positive RA test, blood test, and it's only on one side, or it's there only occasionally. So it's just ridiculous. So we're going to knock RA out of the water. Prevalence, you're talking the most common autoimmune disease. Now, this is affecting about 1% of the world population, about a little over 1 million US. Now, the frustrating thing, when you look at rheumatoid arthritis, it's where the body is actually attacking itself. Have you ever heard of this happening in nature? Like a zebra's just walking along, all of a sudden it attacks itself? No, this is a modern phenomenon. This is something that doesn't happen within species. So this is according to the Center for Disease Prevention. Center for Disease, whatever. Okay. Okay, occurs when your immune system attacks the synovium lining of the membranes around the joints. The resulting inflammation thickens the synovium and destroys the joint cartilage. Now, they're not talking about cause because they don't know. Obviously, you don't want to look at vaccines. Doctors don't know what starts the process, although a genetic component appears likely. Okay, now, when we go over genes, there's a radical difference between gene and gene expression. Genes have the ability to turn themselves on or turn themselves off. So if someone says it's genetic and it was not there and then was expressed, that's not a genetic disease. Okay, it's genetically expressed from environmental factors. And you're seeing the autoimmune disorders rising exponentially. And since we can't look at the medical procedures that are causing it, because that's a sacrilege, okay, it's a mortal sin, not venial sin. Wait, am I the only recovering Catholic? That was like not funny at all? Okay, well, don't worry, Vatican II passed. Okay, so when you look at this, okay, it's crazy that the body actually attacks itself. So this is not chronic illness and disease. It's a modern phenomenon. So what are the real causes of rheumatoid arthritis? What are the real environmental causes? It's not genetic. Okay, what causes the body to attack itself? Well, obviously, vaccines, antibiotic medications, environmental toxins, processed foods can cause a leaky gut, sedentary lifestyle, physical, chemical, and emotional stressors. So when we look at this, let's look at the major chemical stressor. Again, today, I got another patient, this kid from Texas, sweetest little 6-year-old kid, started to develop seizures after his 4-year-old shots, okay? And of course they put him on seizure medications, and then the doctor said, well, it looks like the medications may have caused his autism. Do you think it was the medications? Now, or was it the vaccines? Now, this is a human-animal experiment. We're going to see this increase exponentially the next few years. We've never seen a human animal with 69 doses of 16 different vaccines by the age of 18. That's a brand new phenomenon. Okay, this has only been out and about since the early 90s when the vaccine companies have been absolved of any litigation, so they're producing a liability-free product. Now, what's scary is these people that are vaccinated like this are getting old enough to mate with others that have been vaccinated like this. This is a whole different animal. And then they produce a child that's going to have the similar schedule. Okay, can you see this? And that's why we're going to see it exponentially. Well, currently we have the sickest population on the planet. Yeah. 50% have cancer, 1 in 5 had an autoimmune disorder, which actually, if you look before 1940, this was like almost non-existent. 25% of deaths are from heart disease, liver disease, depression, dementia, thyroid, diabetic, congestive disorders. Understand that chronic illness, it's not part of our makeup. I mean, but if you had 1 in 2 children, 1 in 2 orangutans, 1 in 2 elephants, 1 in 2 zebras, 1 in 2 giraffes with a chronic illness or disease, their children, their offspring, would we go in there and say, what the hell are you feeding these creatures? Would we look at their environment to see the triggers? Yes or yes? Yes. Absolutely, but we got 1 in 2 Americans, children. So if you're planning on retiring, forget that. Retirement's done. Okay, because we cannot retire and expect the younger generation with 50% gone. And by 2030, it's 13 years left. 1 in 2 kids will have autism. So we got to stop this. So chronic illness, when you look at different species on the planet, chronic illness is not from aging longer. In fact, human lifespan hasn't changed appreciably for a couple thousand years. Okay, we're not living longer, we're living sicker. Okay, so it's not in a natural habitat. What I'm saying is the habitat, what we're doing with our physical, chemical, and emotional stress load and our medical procedures, this is not natural. Okay, this is why we're responding with a sick society. Now, let's just take a look at vaccines, because since this is a religion, okay, we can't say anything against them. But we know that it does trigger an inflammatory response, and we know that genetically engineered hepatitis B vaccines introduced during the 80s, series of autoimmune conditions have been reported. Absolutely. And when we look at the side effects, what it says on the label, rheumatoid arthritis, along with a host of other autoimmune conditions. So this is obviously causing the body to respond in a negative fashion. So this is one of those factors that we have to watch. So now, that's enough on RA. We just know not to poison ourselves. So now let's look at the medications used to treat rheumatoid arthritis along with the standard arthritis or osteoarthritis. Now, both of them use nonsteroidal anti-inflammatories, and we're going to see how ridiculously stupid that is. In rheumatoid arthritis, even some osteoarthritis, you're going to use steroids, which weaken the immune system. In rheumatoid arthritis, they're going to get disease-modifying antiarrhythmic rheumatic drugs. Biologic agents, oh my God, you can't imagine what Humira does, okay? We're talking tuberculosis, certain types of blood cancers rise up. So you got to figure treating the body with a chemical has a negative effect. No, you're supposed to go, wow, really? Okay, let's look at what and because we get doctors in here all the time, and they say, well, no, arthritis can't be reversed. No, if you treat it with nonsteroidal anti-inflammatories, okay, you're never going to see it, because these things, they inhibit the building block of cartilage, the building block of it's called proteoglycans. So all your joints in your body have to be continually rebuilt. So if you give a nonsteroidal anti-inflammatory, Advil, Motrin, Aleve, ibuprofen, all of these things, not only are you not going to see the joint regenerate, you're going to see an acceleration of the destruction. Okay. Let's just look at Tylenol. Oh, does anyone know how Tylenol works, by the way? No. Neither do they. Yeah. No, I know. Isn't that weird? Okay, think of this. Okay, I have no idea how this works. In fact, the clinical pharmacology or the mechanism of action is unknown. It is the leading cause of liver failure in America, causes 56,000 hospitalizations or emergency room visits, over 20 billion doses a year, but I still don't know how it works. Okay, so it also, now if you're able to read, Journal of Psychological Sciences, dulled emotional response, 540% increase of asthma risk, if you read the Journal of Allergy and Clinical Immunology, toxic epidermal necrolysis, okay, the Food and Drug Administration, and blood cancers, a twofold increase, okay? If you further understand non-steroidal anti-inflammatories, okay, and this is not the Tylenol, you're looking at a 60% increase in cardiovascular, hearing problems, gastrointestinal bleeding, 7,000 hospitalizations from complications, 60% increase in congestive heart failure. But it's only an Advil. Okay. 30% increase in allergic reactions, 80% miscarriage risk. Population control, anyone? Atrial fibrillation. But you know, I only take it when my head hurts. Honest to goodness, I get this. And it's just like, are you nuts? Journal of Hepatology. Its benefits are said by the Food and Drug Administration to outweigh its risks. It still must be asked, is this amount of injury and death really acceptable for an over-the-counter pain reliever? Is it morally acceptable to have joint pain and be given a drug that damages your system but destroys your joints? We were having, because I'm going to go over the actual cause and the solution of arthritis now. I just had to bring you through my psychosis. Okay, we were at an event in Las Vegas where I'm having dinner next to this person, and we were having a fairly lively discussion. And, you know, I said, well, you had to be a really asshole to prescribe, you know, non-steroidal anti-inflammatory for joint pain. And my wife, being politically correct, leans over and says, honey, he's a medical doctor. And I said, dear, I know. Because it was just rude. Good God, how could you know anatomy and physiology and prescribe something like this? Okay, so let's stop this crap. Okay, we're going to go over grade 1, grade 2, grade 3. Grade 4 is total fusion, and you're not going to see this, okay? But it's a mechanical distortion causing a stabilization of the joint. Normal is just flat out normal. Now, grade 1 is not in the right position, but there's no destruction of the disc or bone. Now, discs get their nutrients through movement. So if you have alteration in movement, you're going to have not full flexibility. Does that make sense? So if the joints are left, and for every 1 inch that heads forward, the pressure on the discs double. Now, is the body smart or stupid? Smart. So if you have 1, 2, or 3 inches of forward head carriage, these muscles are going to scream to reposition it. What do ignorant physicians do with tight muscles? Loosen them up. Why not? Why find out why is it tight? Okay, just randomly loosen it up. Get a massage, inject it, take a muscle relaxant. Well, if that head falls further forward, you can see right there on the second one, you can see the disc spaces are getting smaller in grade 2. And that means it's starting to get unstable. Now you'll see in grade 3, we're seeing severe distortion of the discs at the base. But now here's the problem. Do you see the same degeneration of the discs at the bottom with the bones on the top? No, you don't. So I'll literally get people in, and honest to God, they'll look at this and they'll say, my medical doctor said that this is from old age. Okay? I said, really? How old is this one? Honestly, because you got to use sarcasm in the presence of absolute insanity. Wait. No, bleep that. No, the part before insanity. Okay, so let's look at this. Okay, Kirkcaldy and Willis, this is like the biomechanics Bible. So what you do to find out how the bones work, you get a set of old cadavers and a set of young cadavers. You take their bones out and you put them under compressive and torsion force loading. What did they find? Elderly joints prove just to be as strong in torsion or compression as the younger ones. No kidding. Okay. How many people over 50 in here? Yeah. a little bit tougher and stronger than those 30-year-olds, aren't you? I know. Yeah, okay, so it's true, but I'm telling you right now, this guy is a picture, 75 years old, not a stitch of arthritis, absolutely perfect. And I'll see perfect spines like this, but typically they're in 80-year-old or plus people. And what do you think? Never had a drug, never had an office job, always worked outside, clean, normal, just normal human beings. So what they're talking about is that arthritis, this is a typical mechanical characteristic of scar tissue and implies injury. So the body does not damage, it doesn't destroy itself unless there's a trauma. Now, in ignorant world, we're looking at two groups of people here. One that's decayed, because now remember, chronic illness and disease, this is a modern phenomenon. This doesn't occur in a natural habitat. The woman on the right, who's in her 90s, okay, is normal. Not common. This is just normal for human beings. The crap we're seeing on the left of the horrible treatment, these are people treated with modern medicine and modern chemicals and modern food. And I'm sure they get the flu shot too. Okay, so let's look at how the body is, because osteoarthritis, degenerative disc disease, is not degenerative. It's not degenerative. I know. Right now there's about 3 or 4, you can almost hear it through the internet, some brains just exploded. Okay? But imagine this. What if the body was intelligent? Because I'm going to show you some reversal of the degeneration. You've got a disc right here. Okay, you've got a bone above, bone below. And you'll see it. Normal is normal. Now the disc is 80 interconnecting rings of ligamentous tissue. Now the blood supply to this disc is horrible because it's under such compressive force loading. So it gets its nutrients through movement or through imbibition. Now you've got muscles that run down either side of this spine here that you don't have conscious control over. Okay, they're called postural muscles. So if you have some kind of a trauma, the muscles on the outside portion of this curve are going to increase in tone to straighten it up. If your head's been thrown forward, the shoulder muscles back here are going to spasm out to try and reposition that. Okay, but in that trauma, you've got all of these muscles that are tight because they're trying to protect the nerves. Now, the nerves are what keep your body alive. In fact, the nervous system controls and coordinates every function of the body. So the body has this nervous system surrounded by these flexible joints. So if there is a trauma, okay, the body is going to spasm out the nerves. Now, since the discs get their nutrients through movement, do you think that helps nutrients to the joint or decreases it? Nutrients get to the joint through movement, you're decreasing movement. So less nutrients. Exactly. So instead of a good healthy disc height, that disc gets smaller and smaller and smaller. So now what we're looking at here, degenerative disc disease, bulging disc, herniated disc, thinning of the disc. So thinning of the disc, what happens to the bone? The bone starts to distort. Or think of this, since that disc is not healthy, the bone distorts to increase the surface area so it can stabilize an unstable segment. So this is not degenerative disc disease. This is a stabilization of an unstable joint. Go on, say it with me. Wow, I never thought of that. So if that's true, then all we got to do is cause inflammation of that disc, regenerate the disc, and the bone spurs actually go away. And there's a law called Wolff's Law. Bones lay down where it's needed, resorb where it's not. So let's look at this a little bit different. We know it's the result of a trauma, but let's look at it as intelligent. Now, the disc is 80 interconnecting rings of ligamentous tissue. When you're doing, if anyone's ever cut up dead people, okay, I taught human dissection for a long time. You can take a probe, which looks kind of like a pen. You can pass it in bone pretty easy. Bone's really porous. You can't beat it into a disc with a hammer. It's really, really that tough. And so when somebody says, oh yeah, I coughed and herniated a disc, but that's impossible. Okay, sitting at a desk for 20 years, having poor nutrition and poor motion, decreases the nutrients, and then that can cause an aggravation. That's totally appropriate. I'll go along with that. But to herniate a disc is impossible. It's virtually impossible to do it quickly. It requires a huge trauma or long-term damage. Now this is an MRI on the right, and you'll see the spinal cord coming down and those distortions where the disc bulge comes out. Now, this is also a challenge for a lot of healthcare professionals because when they suspect disc bulges, they're going to order a magnetic resonance imagery. Okay, and typically the patient's going to be laying down for this. Now, a human spine has curves from the side. From the front, it should be straight. If you lay down to get it, you've got the head up here pushing up in this direction, you've got the thoracic area pushing up in this direction, and you got the pelvis pushing up in this direction. So is the body under abnormal force loading?
Yes.
Yeah. Are you going to get an accurate read? No. Guess when they found this out? When they first developed MRIs. I know, it's kind of interesting that you don't hear about this, but when they first developed MRIs, they MRI'd a bunch of people, all with herniated discs. Found 100% of those people had a positive disc bulge on an MRI. Go on, what do you say? Ka-ching. Baby, we got a definitive test now that shows we got back pain. Hey, Joe, how about we MRI a bunch of healthy people without symptoms? Let's check that out. Guess what? 80% of them had a positive disc bulge. Okay, I know, you want to do a homer. Don't! Okay, I know, kind of screwed up the test because now it ain't definitive and we might have to do something other. So this is a computer interpretation of a disc bulge. So if you've been diagnosed with a disc bulge on an MRI, it's not going to be real accurate, okay? Particularly because of the force loading and the position. But we can see that the loss of curve is absolutely indicating a trauma. Now, it takes 3 to 5 years to see a bone change on x-ray. So you can look at this bone change on the film on the right or the left and say, yeah, man, you had a trauma over 8 years ago. Now, it could have been 20, 30 years ago, but this is not a recent trauma because of the bone and disc changes. Now, when we look at this, is it degeneration or is it stabilization? So I want you to look at the bones on the right. Those are normal shaped. Poor forward head carriage, bad position. But look at the shape of the bones on the left. See how they're longer, wider, flatter. Okay, that's all a stabilization aspect of the disc. So it's called degenerative disc disease, but it is not degenerative. It's stabilization. Good God, I can just imagine the comments I'm going to get on this one. Okay. No, my Bible says this. Okay, so we're going to look at subluxations. Okay, a subluxation is a bone that's lost its juxtaposition in relationship to the one above and below. Now, there's a big movement to say that subluxations don't exist. Okay, we're looking at normal on the right, abnormal on the left. You can see in the middle of the neck, the thing curves backwards. Okay? Is that normal or abnormal? Abnormal, yes. Okay, so we can call this Frank situation, okay, or subluxations. Okay, this stupid political bullshit that's going on. But if you have a trauma there, that's going to cause an abnormal force loading, abnormal nutrients, and abnormal motion. Okay, does that make sense? And so what happens is first you have a movement problem. This is called kinesiopathophysiology. Now, since that movement is altered, you're going to have the muscles firing off to reposition this. Okay, and that's called, well, first you got the nervous system pathology, then you got the muscles firing off. Now, if the muscles are firing off long enough, you're decreasing the motion there. That's going to do cellular changes. That's the histo or histology pathology. And if the histology changes or the cells and the nutrients change, then that creates an absolute pathology where you can see changes in the bone, changes in virtually everything. Okay, does that make sense? So if there's a trauma, this has a certain pathway. And you can actually change that pathway. So you have to look at the basic structure. From the side, the body is supposed to have curves. From the front, it's supposed to be straight. Now, and it's designed like this to take care of the nervous system. And if we're talking about arthritis, we got to understand what the function of the nervous system is and how any alterations of this structure can alter the nervous system. So if you're talking kidney function, liver function, organ system function, digestion, prostate function, lung function, depression, anxiety. Is that a factor of having a normal structure or an abnormal structure? Well, let's look at what the science says. Well, first off, the autonomic nervous system is actually inside of this. Okay, we've got the parasympathetic nervous system located in the cranial and sacral area. We've got the sympathetic nervous system located in here. The sympathetic keeps you alive under stress. So this means if you're being chased by a tiger and this area here is firing off, you're going to have decreased blood supply to the gut. That means you're trying to want to run away from danger. You're going to have increased pupillary dilation. If the fight or flight is going off like crazy, do you think you're going to have healthy sleep or poor interrupted sleep? Poor interrupted sleep patterns. What do they tell you when you write down when you're depressed or anxious? Oh, do you have sleep problems? Oh, gee, you're depressed. No, I'm in a sympathetic dominant state. I'm having sleep problems because I got some freaking trauma there. Okay, don't give me a drug for depression. Okay, does that make sense? Okay, now, if you have whiplash trauma or have a trauma up here or a sedentary lifestyle down here, you're going to slow down the parasympathetic or alter that. Since that's rest, digest, and repair, do you think you're going to have healthy digestion or poor digestion? Poor, slow gastric motility, constipation, and bloating, diverticulitis, colitis. So an alteration of this structure can alter the function. What does the research say? Gee, sympathetic and parasympathetic respond to specific diversified adjustments to chiropractic vertebral subluxation of the cervical and thoracic spine. That's the title. Anyone want to read this boring thing? No. I'll boil it down. You adjust the thoracic area, you can alter the sympathetic nervous system, you adjust the cervical and sacrum, you alter the parasympathetic nervous system. It's kind of that simple. It gets a little bit different when you're talking about proprioceptive responses, but it's in the ballpark, okay? We're looking at Journal of Manipulative and Physiologic Therapeutics. Again, autonomic function. The somatosensory neck and its efferent effect on the sensory nervous system. I mean, we're looking at all of this data that shows that the automatic nervous system, autonomics, is affected if that spine is misaligned. So think of this, okay? No, doc, I don't feel it because 90% of the nerves that come off the spine, there's no pain fibers. But my digestion is poor. I've got cardiac arrhythmias. I've got high blood pressure. Can you see why we need to look at the controlling mechanism first? Does that make sense? Yeah, nothing else does. This is interesting. Somatodysfunction and visceral disease. It talks about a phenomenon that chiropractors have been experiencing for about 100 years. Well, actually, bone setters were confronted with that. Hippocrates said when confronted with disease, first look to the spine. Now, why would they say that? Now, this phenomenon has been going on for over 1,000 years with other healthcare professions, but they found that if this body is misaligned, or if there's some type of alterations of the structure, it has an effect in the organ systems. Isn't that interesting? So, should that be like the first place to look? Well, let me talk to you about Susie. That's a ridiculously cute kid on her lap. Yes. She comes to me a few years ago. He's actually 5 now, and he is just absolutely not as cute as your kid. He's pretty freaking cute, though. Yeah, she builds really cute kids. Okay, but okay. So she comes in, and she's got a 3-month-old fetus and a great tumor the size of a grapefruit. Well, you know, she went to one doctor. They said, hey, look, we cut the tumor out. The kid's going to be born deformed. It's best that you destroy the kid, and then we take the tumor out. And she had a problem with that. She thought killing a kid wasn't nice. Okay, so she comes to me, and her sister actually brought her in, and she was pissed. She says, I don't have back pain. I have a tumor and a baby. What are you taking me to the chiropractor for? She says, no, come on in. This guy understands the nervous system. Come on, really. Okay, so at the time we had a diagnostic ultrasound machine, which was really, really cool. I actually didn't know how to run it, but one of my patients did. Okay, yeah, big circumstances there, but it was kind of cool. Yeah. So So I said, look, I can't take an x-ray of you, but I know that the adrenal glands produce interferon. I know the body, if it laid down a tumor, it can resorb it. It's in the area, so you've got an unstable pelvis. So we're going to adjust the nerves that supply that tissue and strengthen your immune system. And then we'll monitor the tumor. If the tumor progresses, then hey, surgery is an option. If the tumor starts to go away, then having the baby would be an option too. Okay, well, within 3 months, now the kid's 6 months, the tumor had shrunk from a grapefruit size down to a little small lemon or lime. And then we did one more diagnostic ultrasound on 7 months, and the tumor was shrinking smaller. When the kid's born, guess what? No more tumor. Yeah, and Eli is just freaking darling. But you got to see the testimony, because she got this kid jumping around. Thank you, Dr. Bergman. And she didn't look too happy. Looked a little fatigued. But the kid's cool now. So, do kids have arthritis?
Yes.
It's interesting. Rheumatoid arthritis, a lot of them are having it because it's an autoimmune condition. But remember, when we're talking a mechanical distortion, knowing that even birth process can have it. Okay, this is why kids got to be checked right away. Harvard Medical School, I don't know if you've heard of it, it's back east. Abraham Tobin, a brilliant guy. Research indicates that major cause of spinal kinesiopathophysiology, this is subluxations, or that movement alteration of the spine, in infants in childbirth is widespread, in our minds stressing the need for correction from birth so that irreversible subluxation degeneration changes do not occur. Wow, interesting. And here's Chung-Ha Su from the University of Colorado. If subluxations are not corrected when they're first caused shortly after birth, the subluxation will be difficult or impossible to correct later. Absolutely. So now, and it's interesting too, because I get this like, look, wow, when do you want to check our kids? Jesus, as soon as they come out. If you're having a birth close by, give me a call. I'll swing by and check you right before they cut the cord. How long do you want the kid to have nerve pressure? So here's one. This is a normal x-ray on the left. This is a common child that comes into our office. 2.5 years old, C-section birth. Now, if you're familiar, the birth on a C-section puts 4 times the amount of pressure on a child's neck. 4 times the amount of pressure. I know, you were going to say, gee, I thought it was easier than going through that vaginal canal. No, human beings are actually designed to be birthed through a vaginal canal, not designed to be cut open the stomach and pulled out. I know, it's amazing. Birth is a natural process. Okay, so now, trauma on his neck, multiple ear infections, so antibiotics, fully vaccinated, so he's had about 20 vaccines, behavior issues, no kidding, leaky gut, everything else, severe skin allergies, and a reverse curve in his neck. So by getting him out of the pressure, did we stop any further arthritic changes? Because this is grade 1 arthritis in a 2.5-year-old. Yeah, we got him fixed. Okay, so now let's look at all joints. Okay, all joints in the body other than the spine, other than the discs. They're basically 2 bones coming together, surrounded by a joint capsule. Now, inside of that joint capsule is a superfiltrated blood called synovial fluid. Now, this is why, and this is, again, we got to deal with ignorance. When we talk about cartilage and meniscus regenerating, you'll hear these people say, well, no, the cartilage in the knee, on the central portion, it's avascular, so it can't regenerate. Okay, avascular means there's no blood vessels there. No shit. When you're standing on it, you got this femur on the plate of the tibia, it's underneath a lot of force loading. Okay, so if you had blood vessels there, it would be crushed. So then you talk slow to these people because they're obviously not critical thinkers. Use one-syllable words and say, yes, it's avascular, but it's not acellular. That means it has cells. Now, are the cells in this cartilage alive or dead? Okay, talk slow. Okay, and they'll look down at the ground and they'll say, well, I think they're alive. And if they don't say that, and they're really humming and hawing, say, well, do you have dead cells in your knee? Or are they alive? Well, I never thought about that. They must be alive. Okay, good. If they're alive, that means they got to take in nutrients, produce proteins, eliminate waste products. Does it make sense that they would utilize the synovial fluid as a nutrient so they can do this cellular process? Well, yeah. Okay, by this time they'll be drooling on themselves and leaving. Okay. Okay, but understand, it may be avascular but not acellular. These are living cells. And the reason I'm telling you this is because so many idiots out there that are in a position of authority say, Jesus, you got no cartilage on there, it's bone on bone. If you can bend it, it's not bone on bone. It's bendable. You could have one layer of cells in there and be able to regenerate it. Okay, and I'm going to show you now. So think of this. The synovial fluid is a superfiltrate of blood. So if the blood is not healthy, does that mean the joint's not going to be healthy? Absolutely. Is this why diabetics have joint issues? Absolutely. Gout, same thing. Toxic blood. So we got to look at the health of the blood. Now, red blood cells should look like little frisbees floating around in there. If you see them clumping together, that's called rouleau coin formation. That comes from a diet high in polyunsaturated fats or low in stomach acid. So is this why if somebody's taken an antacid like a Prilosec or Tums or Rolaids, okay, low stomach acid causes blood cells to get sticky. Is this why they say joint pain on the side of the bottle? Yeah, of course. You're not going to have antacids. You need healthy acid. You need healthy blood formation. So this means healthy blood. So this means the nutrients we put in our body are going to be vitally important with how the health of our joints are. Does that make sense? Okay. Blood has a function. Okay, now it carries nutrients, it carries oxygen, it balances the pH, it regulates temperature. Vital to the immune system. Which one of these factors would you be healthier if we reduced?
None of them.
None of them. You mean you need healthy nutrients, you need pH, you need a good immune system? Okay, so what animal species on the planet, and this is for the critical thinkers, okay, can't regulate their own blood pressure? Giraffe can't regulate their own blood pressure. You're right, those little bastards are passing out every time they lift their head. No, a giraffe has the highest blood pressure because it's got the longest friggin' neck. Okay? But the giraffes, can they regulate their own blood pressure? Go like this, yeah. Any animal need help with a chemical to regulate their own blood pressure?
No.
No, so you've been taught a lie. If your blood is crappy, the pressure has to increase. So if you have dehydration, a crappy diet, look at our blood pressure videos. If you're taking a drug to lower blood pressure, check it and find out why. If you're taking a drug for cholesterol, what is the function of cholesterol? If you go in there and a doctor tells you to take a cholesterol drug and you say, Doc, before I take this pill to lower cholesterol, I want you to tell me what's the function of cholesterol. If they say, well, gee, it's the precursor to every glucocorticosteroid, minocorticosteroid, and sex hormone, it protects you from cancer, it doesn't clog any arteries. In fact, we see higher disease rates at lower levels of cholesterol, and it's 70% of your brain. If they say that response, then they're knowledgeable about cholesterol. If they say any crap about good cholesterol or bad cholesterol, they're an idiot, they need to be fired. Cholesterol does not clog arteries. It does not clog arteries. Higher disease rates appear at lower levels. But cholesterol is used as the precursor to the greatest anti-inflammatory you got, called cortisol. So if you have inflammation because of tissue damage or poor diet or some type of trauma, cortisol levels have to be up, so cholesterol levels have to be up. Does that make sense? Okay, the body is self-regulating and self-healing. Do we have a problem with that? When we look at this, okay, we're looking at the same person 90 days in the future. Okay, what they came in with, this twisted up mess, 20 degrees buckling down to 2 degrees buckling. Okay, so what do we know about arthritis? We know that osteoarthritis is a mechanical distortion, okay, that caused abnormal force loading, that causes the disc to change in shape. So we have a movement pathology, a neural pathology, a muscle pathology, then the tissue changes shape. Are you seeing a change in force loading on this? Yeah, and it's kind of cool too because he had back pain, neck pain, knee pain, you know, the usual stuff. Okay, also high blood pressure. This is what the guy's back looked like. Okay, and again, we got pre and post, 19 down to 12. Now, it's interesting because the knee is supplied by the middle of the lumbar, the third lumbar. Now, I'm going to show you his knees. His knees are really cool. Okay, do you see anything that looks like maybe not a real knee? Well, it is a real knee. Okay, it just happens to have a couple of bolts in it. Now, what's interesting is this is not bone on bone. Guess which knee had his pain? This one. And the doctor said it's bone on bone. But see the shadow thing here? That's called a patella. It's supposed to be in the middle of the knee. So this is a patella tracking issue. So his knee pain was actually stimulated because the nerves that supply, that guide that patella, was not working correctly. Now, the knee with the patellar tracking issue was causing pain. The other one was, kind of irritating. But it was interesting. He couldn't walk upstairs with it, but it didn't hurt. Okay, now this is pre and post. Now, what's interesting, you're not seeing a lot of structural changes because this is 90 days afterwards. He wanted me to take an x-ray of it because, doc, it didn't hurt, but I couldn't bend it. I couldn't walk upstairs and all this other stuff. And so we didn't fix the knee. Okay, what we did, we fixed the calf muscle, the biomechanics of the foot, the nerves that supply it, the patellar tracking. So we fixed all the structures around it. Now there's slight changes, a little bit thicker cartilage, a little bit that. But the difference is he could walk upstairs without any discomfort whatsoever. Now this is how you find a disc. Okay, you're not going to use an MRI because that distorts the spine. You find a disc by taking bending films. Okay, so the one in the middle is neutral. Then we bend it right, bend it left. And you should see normal disc motion. It should bend just the way you would think. If you see an abnormal disc motion, because when you're bending off to the side, and we're talking just basic common sense here, you bend the spine this way, the discs should be narrow on the inside of the curve and wide on the outside of the curve. Again, when you're talking to most medical professionals, you have to talk slow. Okay? You bend the other way, guess what's going to happen? It's going to be narrow on the concave portion and wide on the convex portion. If you see something that's reversed like that, that's abnormal disc motion, and that has to do with proprioceptive firings, trauma, some type of movement pathology is occurring. And that, if it's left like that, is going to deteriorate the joint. So it's pretty easy to fix. When you have post-surgery, now, knowing that surgeries have to be repeated because you're going there and altering the mechanics, you're looking at the fake disc, bolts, screws, everything else. Guess what? I know this is going to sound crazy, but if you have a spine that's supposed to move correctly, okay, and you fuse a segment, guess what happens above and below the surgery site? It works. Extra movement, absolutely. It progresses. So it's not like, oh God, I had back surgery and I hurt. Should I go to the chiropractor? It means you have to go to the chiropractor. And so we're identifying problems that caused the original surgery. Here's one that's a travesty. They did a surgical intervention in this woman, and I'll show you more about her, but I want you to look at this. These things are bolts through the spine. Those are not small bolts. This is the base of her neck going all the way up. Now, she only had 2 movable bones. What was interesting is we started to move those and she started to feel better. They removed a lot of the bolts. Okay, now that took, Herculean effort and legal stuff to get it removed. But this is her before, when they had all the bolts in on the left. Her new one, they couldn't remove all of the bolts because they actually had removed a good hunk of the bone to get in there. But the baggies are the bolts, screws, pins, and rods that they put in and took out. I mean, surgery is needed sometimes, but we see most of the surgical screw-ups. And this one, I mean, it's just like it never needed to happen. And she went in there for scoliosis and she started to get Parkinsonian tremors. Why? Because the brain functions like a battery. And what people forget is that if you alter the motion or position of this, you're altering the information up to the brain. And how you could be smart enough to knock a person out and put all this hardware in there and wake them back up, but be so ignorant that that movement is going to alter brain function. It's like, my God, there's such a chasm between common sense and the medical authorities. Here's a gal, paraplegic after a car accident, but she has a scoliosis. Now, you can see a bolt and screw. This is her sitting in her wheelchair. Now, on a surgical like this is neutral. You have to take flexion and extension. Okay, now, she's paraplegic. How much correction can we get here? It's unknown. Unknown. But what's a human being's potential? Unlimited. Unlimited. And it's interesting too, she said she was drawn here, and she's now starting to get like ant-like feelings and stuff, which is nerves starting to come back. But honestly, when we did her, this is her neutral, bending right, bending left x-rays while she's in the chair, she's going to have some good recovery. Now, here's a fellow, the same thing. And we're looking at bullet fragments in his neck, but he still has a subluxation above that and subluxations below that. Now, the spinal cord is not a bunch of nerves. It's a long tubular brain. And when you've had a trauma like this, the body can rewire it. Has anyone ever heard of like people with a stroke that they had to relearn how to walk or relearn how to talk? But they did, right? Okay, and that's because if the area of the central nervous system is damaged, the body is like Star Trek. It can rewire stuff from the phaser unit and put it in the life support. Wait, Star Trek is like 40 years old. I really got to come up with another analogy, okay? But you kind of get it, right? Okay, if there's a damage, your body is going to find a way to work around it. Now, what's interesting, this is the side view, and we're doing flexion and extension to identify the trauma. We can't adjust over the area of the bone fragments because that's still embedded in the bone, spinal cord, and some of the muscle tissue. But by gosh, we can move above and below. And what you're also seeing here is this top bone in the neck, okay, which has a circle in it. The top bone is a circle, but you should, on the side view, you shouldn't be able to see a hole or in between my hands. That means his top bone is spun like this. So getting pressure off of that brainstem, does he have a better chance of recovery? Yes. Absolutely, have to. I mean, here's the standard guy, okay, 56 years old, Tylenol, steroids, antacids, of course metformin. He was pre-diabetic. Okay, what's pre-diabetic? Made up. You know, I'm pre-dead. Be careful. You know, another 50 years, I'm out of here. You know, this is like such made up terms. Okay, yeah, high cholesterol. Geez, what's the function of cholesterol? I don't know. You want to get diabetes, take that pill. Okay, you know, that's him 90 days later, just normal. I mean, it's just called respecting the body. This is a travesty. She came in 17-degree buckling. After 90 days, we got it down to 7 degrees. But then, and she went from, 6 medications. She was down to 2 medications. She was walking with no pain. 2 years later, she comes back, 3 epidurals, 7 medications, massive pain walking. And it's just like, why? You know, why are you taking a drug to solve a mechanical distortion of the spine? It doesn't make sense. I mean, am I the only one it doesn't make sense to, or does it make sense to anyone? You know, you got a problem with the tire on the car. It's going like this. Okay, good. We're going to put a better shock in so you don't feel it. Car analogy work? You know, fibromyalgia. Jesus. We already know that this is an alteration of the spine. Is that altering the organ system function? Absolutely. It's altering the parasympathetic, sympathetic, and then afterwards, no medications, normal. Why would you medicate someone without finding the cause? Okay, we're looking at reverse curve to normal curve. This is carpal tunnel syndrome, and I think she has some asthma problems. Again, reverse curve to normal. Reverse curve to normal, and you might even see here, this joint looks fused, and now all of a sudden, we're seeing the joint regenerated. Wow, that's cool. Okay, it looks like discs regenerate if you take the pressure off of them and restore motion. This is fun. I had a gal come in. I think she was like 16. Her pediatrician said she had scoliosis. Okay. And I go in and I had one of my guys take the x-ray, and he says, oh yeah, it's really bad. And I think, wait a second. This pelvis looks a little low here. Does she have any leg issues? Yeah, she twisted her ankle. I said, okay, get her back in there. Yeah, my ankle hurts. Okay, yeah, okay. Yeah, a miracle. Cured scoliosis in one visit. No. Okay, so don't get fooled over that stuff. So realize that your body, when it breaks down, because what we do to regenerate joints or to regenerate discs is we cause inflammation. And this is causing inflammation. That's how the body regenerates the tissue. And when you cause inflammation, you're going to create free radicals. And so this is why when we talk about during the adjustment process or during regeneration of tissues, you have to have a lot of fresh fruits and fresh vegetables. Why? Because the free radicals it's an ill-charged molecule. It's missing an electron, and free or antioxidants have extra electrons that they can give up to neutralize it. See, so when we talk about taking an anti-inflammatory like an orange or fresh fruit or fresh vegetables, you know, people will say, well, doc, aren't you causing inflammation? Don't you want the process to occur? Yeah, this isn't going to stop the inflammation. It's going to stop the byproducts of the building. See, you've got two cells. If you look at it this way, cytokine 6s are the inflammatory cell. They stimulate cytokine 10s, which build the new cells, which build a new tissue. The new cytokine 10s don't get activated until you get the demo crew in, and that's the cytokine 6s. Construction analogy, does that work? Okay, yeah. But this is taking care of the byproducts of the inflammatory process that we cause to regenerate the joints. It doesn't cause or stop the destruction process and stop the cellular breakdown process and the cellular build process that the non-steroidal anti-inflammatories does, okay? So if your chiropractor is adjusting you and says, eat some fresh fruit, that'll take care of the inflammation, he's talking about the byproducts of tissue regeneration. Vitamin K2, I love this. Remember how we're talking about rheumatoid arthritis, how it attacks the synovial membrane? You've got to have a healthy synovial membrane. Vitamin K2 not only remineralizes bones, but destroys the rheumatoid arthritis synovial cells. Destroys it. Wow. So is anyone with rheumatoid arthritis, are they recommending fermented vegetables that, my God, this is a miracle drug? It looks like it destroys that? No? No? Okay, just checking. Fermented foods, breathe, it's all important. Okay, to get your body healthy, you got to optimize the gut flora. Coconut oil, fermented foods, juiced vegetables, blended fruits. I mean, just the standard stuff. Turmeric in rheumatoid arthritis. This strategy may support the regeneration of articular cartilage. Good God! Turmeric can regenerate the cartilage. So when somebody says, no, you've got compressed cartilage and nothing can regenerate it, and this happens to be a medical authority, go in there and say, gee, doc, can you read the Arthritis Research and Therapy Journal on turmeric? Turmeric, commonly used spice, antimicrobial, antioxidant, anti-neoplastic. Again, this helps with regeneration. Xanthophylls, okay, now this, antioxidant, anti-cancer, colon cancer, okay, carotenoids. So this is why we're talking about carrot juice, apple juice. Why? Because that's soluble fibers that clean the arteries. Carrot, sweet potato, kales, butternut, squash. I mean, this just looks good to eat. Cruciferous vegetables, again, cancer preventive, anti-carcinogenic, but it also regenerates and cleans the blood. Okay, broccoli and Brussels sprouts. I mean, just good, natural, healthy, plant-based diet helps. Curcumin inhibits tumor cells, decreases inflammation because it has the antioxidants, angiogenesis, so healthy blood growth. So when we put this up and we talk about healthy nerve supply, can you see how you can't regenerate the body unless you have healthy nerve supply? Regular exercise. This just moves your body. Geez, we've got a vibration plate. You don't even need to move it yourself. Just stand on it now. Proper nutrition. This means if man makes it, you don't eat it. Sufficient rest, because you're not going to regenerate if you can't sleep. And prayer and meditation. I mean, it seems too simple. But I mean, if you cut yourself, does it heal? Or do you have to say, hey, wait, don't talk to me. I gotta fix this. No. It's going to heal no matter what. Why? Because that's inflammation. And the body is going to stimulate those cells. The way that you fix arthritis is fix the trauma, realign the bones, cause inflammation, clean the blood supply, and it regenerates. Now, any questions?
How is it like one person with similar subluxation suffer from knee pain in the lower back, other one suffer from fibromyalgia, another one suffer from example for degenerative disc disease? I mean, is there a pattern of it, or is it happening randomly that similar subluxation or trauma creates different conditions?
It's interesting because it also depends not on the subluxation, particularly when you're looking at 50% of neck or of back injuries are from the neck, because the spinal cord doesn't stretch. So if you have forward head carriage or trauma here, it's going to negatively affect here. Now, there was studies back in the 20s of a medical doctor that found a diseased organ and traced it back always to the same area of subluxation. So kidney disease would be to these two, heart disease would be to these two, and he did it over 100 different cadavers. So that segmental organ system supply was thought to be like the gold standard. Okay, however, what we're seeing, it's not just the nerves that come down, it's the canal size. So some people can have a huge canal where the spinal cord comes down, and they can withstand huge disc bulges, huge trauma, and not have a negative effect. Other people will have a narrow disc bulge. Like I've seen football players, massive Marines, destroyed by one disc bulge. And I could see like a teenage girl with, 4 or 5 disc bulges. Cheerleaders are the worst. They get beat up like you can't believe. Okay, and they're, having difficult menstrual cycles instead of, just massive pain and can't even walk. So it has to do also with your body's ability to regenerate. So you boil it down to 3 stressors: physical, chemical, and emotional. So if you have, great relationships, you're emotionally stable. Physical, you've only had one physical trauma, not multiple compounding. And if you have great sleep, perfect diet, perfect nutrition, you're going to be able to respond to certain traumas better and more effectively. If you've had high physical, chemical, and emotional stress, even the smallest little force, will send you out for, down for the count. And that's why when you're treating arthritis, you don't work on just the joints. You don't work on just the joints and nutrition. You got to work on the emotional state, because emotions are chemicals secreted by how the brain perceives the environment. You got to work on deep sleep. You got to work on elimination. You got to work on biomechanics of walking. You got to work on restoring the feet. So it's called holistic, but that's kind of a ridiculous term. Any doctor that's working on somebody, whether they've got a blood disorder or arthritis or breathing disorders or tumors, if they're not working on the entire body, they're really missing something. Does that make sense? You got to look at every aspect.
Is there a reason why, if someone had arthritis, say like in their neck, where you wouldn't do an adjustment?
The only way, like I just showed you, bullet wounds in the neck, paraplegic with a fused vertebrae in the neck, the area above or below, you can adjust safely, but you're not going to adjust over those areas of trauma. And if it's fused, it's a wasted time and effort. So how you determine if it's fused is a stress x-ray. So if you go in, and I do this a lot, take an x-ray, and by God, it looks fused. Not sure if it is or if it isn't. So now let's take a stress x-ray and bend that and take a picture. If the joint's move, then bam, it's fair game. We can get in there, cause inflammation, reverse the arthritis. If it's not moving, then it's fused. In fact, I could show you a mistake that I made. I looked at this and I didn't do a stress x-ray on her at the time. And I said, wow, miss, you have grade 4 arthritis. That's fused. Okay, we do the post x-ray. Wow, hon, I was wrong. It's not fused. You're regenerating the disc. It's cool to be wrong like that. Okay, but I got to tell you, you know what that taught me? Always do a stress x-ray. Okay, so this way you can be assured, and so you're not guessing at this stuff. Gee, I don't know if I can help you. This, man, it's definitive. Okay, so if that shows no movement, I wouldn't adjust that area. I'd adjust above and below it, because it doesn't make sense to adjust something that's fused.
Like, you're going to adjust the kid day 1, but when are you going to take an x-ray of them?
Typically, if they had a birth trauma, I'll take it that first week. Like if it's C-section, torticollis, something like that. And this is the most fun thing. We get kids, home birth, mom never got vaccinated, dad never got vaccinated, they ate right, organic, normal, not hippies, these are just educated people. And midwife, never seen a hospital, kid, no vitamin K shot, which is polysorbate 80, which crosses the blood-brain barrier, no hepatitis B shot, because they didn't think the kid was going to be an IV drug user, at least not at that age, okay? So I get this perfect, beautiful kid in, and I'll check him, and there's nothing to adjust. It's the coolest thing ever. It's like, this is normal. I don't see normal. And I'll show them little things you could do, you know, to stimulate like the sacrum so they can start farting and pooping regular. I'll show them how to overstimulate the central nervous system so the kid can sleep better. Also helps them. And then we check them on a regular basis, and, you know, I give them my phone number so they can call me at any instant. You know, hi, he's got a fever, or what do you do? Yeah, because they're obviously not going to take him to get drugged. Yeah, that's the most fun. Yeah, but typically on kids, if they had a trauma, we'll x-ray them right away. And then we won't do post x-rays on kids. We'll wait till they're teenagers, because they're going to have a snowboarding incident, cheerleading. God, I hope they don't do football, you know, martial arts. They're going to be some kind of trauma. Okay, now next week we're going to talk about the questions that get asked all the time if you're not vaccinating. Like, is your unvaccinated kid going to spread disease? Okay, we're going to really hit a couple of those questions hot and heavy, like herd immunity. You'll find out how that's complete ridiculous bullshit. Okay, we're going to talk about how healthy humans are actually supposed to be.